For me, the dancers like Imani are the ultimate athlete artist. It's such an incredible combination, you know, of athleticism and artistry, and they fall somewhere along that spectrum, and to me they're the pinnacle, because I've taken care of professional football players, and athleticism is underappreciated too many times until you get to treat these dancers.
To me, ballet is an art form that blends art and athleticism. So in the same way that we are artists, we are also athletes, and we use our whole body to tell stories, to convey ideas, and to really just introduce people to the fine arts.
So many of their injuries are foot and ankle specific, which is my specialty. So I kind of get to be, you know, the primary care ortho guy for so many of the dancers, because 50% of what you guys get is foot and ankle related. So studies have shown that at any given time, between 30 and 50% of the dancers will have a foot and ankle injury during the season. So it's a tremendously high incidence of foot and ankle related pathology, because you guys rehearse hours and hours and hours for any given performance.
Having our classes in the studio and then being on stage, it affects your body differently, especially when we're doing like a lot of high impact things. And then with women having to dance on point, it's probably that adds to why you're seeing ballet dancers as patients for foot and ankle specific injury.
Major injuries and major sprains, these can be career-ending injuries, as you know. It's important that we're aggressive in the diagnosis and preventive phases before it gets to surgery.
The type of physical pressure and strain that we're putting on our bodies by stretching it to its limits, and there's only so much that we can do at home to prevent injury. So having partnership with TOA and being able to see orthopedic doctors who, you know, can check on us and make sure that, you know, we're being able to perform at our highest level is essential to being able to do the work that we do here at the Nashville Ballet.
It's easier to live your best life as a physician when you're treating supremely gifted, healthy, physical specimens like yourself. To live my best life as a physician, I need to treat those people the same as I treat you. If I treat them with the same respect and the same hope of healing, they tend to respond in kind, and they become better patients, and that makes me a better physician. It has a lot to do with how you treat people, emotionally and spiritually sometimes too.
Yeah, that's so interesting, thinking about living your best life and about how you relate to others, and that being able to define your best life. That's really cool.
That's a good question though.
Yeah.